Please come to the podium and introduce yourself. Please state your name and any organization you are representing for the record.
Good afternoon. My name is Dr. Kathryn Wagner, and I have no financial interest in the outcome of these proceedings. I am a neurologist at the Johns Hopkins School of Medicine and director of the Center for Genetic Muscle Disorders at Kennedy Krieger in Baltimore, Maryland. I have cared for boys and young men with Duchenne for over 15 years. I have 2 patients who participated in the 201-202 study, 4 subjects in the current 301 study, and 3 subjects in the current advanced stage 204 study. None of these 9 boys has experienced any drug-related side effects. They are all doing extremely well with their disease. I cannot say that eteplirsen has definitely benefited every boy, but it has benefited most boys. Duchenne is a profoundly disabling and fatal condition without exception. After the age of 13, there's a progressive downward decline. Individual measurements such as the 6-minute walk test may have small day-to-day variabilities, but the course of the disease is consistently downward in the teenage years. Clinically, we rarely see a teenager remain stable over 6 months and never over 2 years. Yet to highlight just one subject in the 201 trial, 006, his 6-minute walk test has remained stable over 4 years with values of 355, 329, 359, 332 meters. He is now over 14 years old and still able to rise from the floor. He had no dystrophin at baseline and now has 20% dystrophin-positive fibers and 2.47% of normal levels by Western blot. If I were this patient's physician, I would see the stabilization of function over years and want the option to prescribe eteplirsen. Muscular dystrophy physicians routinely monitor timed function tests and weigh the risks and benefits of drugs for our patients. We prescribe corticosteroids and follow the rise from floor, run time, and/or walk distance while monitoring the multiple side effects to behavior, bone, and weight, among others. We discuss our findings with the family, with whom we make informed decisions whether to continue, reduce, or withdraw a drug. With corticosteroids, we see much less stabilization of function and much more side effects than what has been demonstrated with eteplirsen. From experience with corticosteroid management, the physicians, families, and communities are well equipped to make individual assessments of benefit of eteplirsen. As a physician, I want the option to prescribe eteplirsen. We cannot withhold a safe drug from even one boy who may benefit.